I'm Brandy Hill, and I'm here today with Dr. Robbins and Dr. Hill of CoreMedX. And I think a lot of people are curious as to the what and why of this merge. And so we thought we would do a quick Q&A session to help you guys understand better what CoreMedX is. Welcome, guys.
Thank you, appreciate it.
Yeah, so I think the first question people want to know is, why did the doctors of Cornerstone Complete Care and Hill Chiropractic decide to merge? Dr. Robbins?
Yeah, well, we ended up going to a conference together. We were doing some continuing education classes, and when I said together, we weren't together. We went to the same one, but didn't know that both of us were attending. And we were studying some of the same subjects and same topics. And when I found out that Dr. Hill had a real interest in some of the same things I was studying, then it gave me the idea to get together and meet and just kind of talk over, where he was at and his philosophy in treating patients. And we just started to blossom from there.
Awesome. So merging together, that's a big deal. It's not, I'm sure, not a decision you came to lightly. Why did combining forces seem like the right move for you all?
So just to kind of pony back off of what Dr. Robbins was saying is as we kind of got to know each other a little bit more, we started having some lunches and we kind of, got our ideas out there, and we were really heading in the same direction, same path. And we started just saying, well, what would this look like if we kind of, merged together and brought this idea together? Now, on the same component there is we got to know each other a little bit more, and we realized that our faith was very strong, and we had very strong family backgrounds. We both loved our community, loved our family, loved God. And so we both had a passion with helping our community and seeing our community being healthy, and helping other issues that, neuropathy, things like that, are very prevalent right now in our community. So that's kind of where we started to kind of say, let's see what this looks like. Let's go down this path a little bit further.
To throw something in, as we got to know Dr. Hill, I found that his passion for helping patients was very similar to mine. He was all in on getting people well, and he was using a lot of cutting edge techniques, as do we. And so we started getting a vision for this model where we would be combining the best of both practices, the best of both worlds, and also bringing in other professions along with us. And it got us excited. So that's one of the main reasons.
Awesome. So I think another question people might have is, you've changed your name, you've come together and you've changed your name and you named it CoreMedX. What is CoreMedX?
Well, again, we started talking, and the common thing that we kept saying is we wanted to get to the core problem of things. We wanted to get to the core reason why people were gaining weight, why people were not losing weight, why people lost weight, gained it back. We wanted to get to the core reason of why is the nerve dying? Why are we dealing with neuropathy? Why are we dealing with a disc that you go get surgery and a couple years down the road, you're going to have the same problem again? We wanted to get to the core issue of, arthritis. So that core word just kept ringing and ringing. And so CoreMedX just kind of came kind of to Dr. Robbins in multiple ideas, and it just really popped out at us, and that's kind of what we went with. We rolled with it.
Yeah, we like to make kind of snappy.
Yeah. So I hear medics in there, and we know you guys are chiropractors. So is it safe to say that this new clinic is not just chiropractic?
Yeah, we have a multidiscipline approach, and so what that means is we have lots of answers for lots of problems, but we don't have all the answers. And so I've worked with physical therapists, I've worked with medical doctors, nurse practitioners, PAs in the past, and everybody brings a piece of the puzzle together. Mm-hmm. And so our goal has been to ask everybody to kind of put their egos aside. And when a patient comes in, many times it's the last stop. They've been to 2 or 3 other docs. Sometimes it's the first stop, but a lot of times it's the last stop. And we take all the information that we gather, we do exams, we do x-ray, we do diagnostic work, and we have all that information. We sit down as a team and we go over their case, and we'll spend time discussing, looking at x-ray, looking at MRI, and discussing, hey, what's the best approach for this patient? And then we come up with a multidiscipline approach where maybe we're having our medical doctor do a specific treatment, the chiropractors do a specific treatment, the therapists are working with strength training and whatever it may be. But we come up with an approach that's got the best of both worlds, so it all comes together. And so far, it's worked out really well. We've had some phenomenal results with some very tough cases.
Wow. So it's safe to say that there's no other clinic in this area that's doing anything like this.
Not in this area, not that we're aware of anyway. As far as South Central Virginia, I think we're the only one.
Very cool. All right, so we get a lot of questions from people in the community that say, what conditions do you treat? What services do you offer? And I know you've touched on that some, but maybe you all could provide, a quick bullet list of different things that people can know, oh, I need to call them.
Sure. We treat disc injury, sciatic pain, shoulder issues, neck issues, disc problems in the cervical spine, weight loss issues, neuropathy. We work with musculoskeletal issues, sprain, car accidents, automobile accidents. Really anything related to musculoskeletal we have good results with.
Great. Anything else?
Those are the nerve-related problems, things that haven't. So many times people walk in the door, they don't know exactly what's going on.
Mm-hmm.
They don't know, doc, I've got this pain here, but I don't know what it is. I've been to 2 or 3 people, they haven't diagnosed it. They just, even we have patients walk in the door, they've been told it's in their head. We're not so sure it's a real problem, it's anxiety or something like that. And so our job is the very first thing that we do when someone comes to our office is to try to figure out if they're in the right place or not.
Mm-hmm.
We want to be able to look them square in the eyes and say, yeah, absolutely, we can help this, or right up front, don't waste your time. This is not something that we can help, but we can get you to a specialist that can. So our first job is we got to diagnose the problem, and we do a lot of that with all the different types of conditions that Dr. Hill mentioned. So those are the things we specialize in, and those tough and chronic problems for sure.
Awesome.
The other thing I'll add to that too is that a lot of people deal with autoimmune issues, things like that. We work with functional medicine a lot to again get to the core issue there, and a lot of the core issues that we're dealing with that is inflammatory diets that are plaguing this country. Mm-hmm. And so those are things that personally, my own experience, functional medicine has helped me tremendously get my youth back.
Mm-hmm.
Yeah, and I was going to a medical practice where the medical doctors were open to other ideas besides just pumping you full of medicine. And so I had to drive 2 hours to go to one of those practices for my own family. So that was part of the impetus of getting this set up in Danville, was there was nothing like this anywhere close. So it's a 2-hour drive if you're not going here. And so that's why we wanted to bring that option of functional medicine in.
So what would you say sets CoreMedX apart from other clinics in the area?
So just to reiterate, a patient coming in is going to get it's going to be seen by all doctors. So chiropractic, medical, and then we're going to take that information that we gather and we're going to collaborate as a team to figure out what does this patient need specifically for their needs. And then once we get that information together, we bring the patient in, and then we do what's called a report of findings with that patient, and we'll give them our prognosis of what we need to do for this patient's individual case.
Depending on the type of treatment you need, we have many options, and so that does set us apart. We don't have to send you off. If you need medication, we have somebody who can do that. If you need therapy, we have somebody who can do that. If you need So we don't have to. I think patients really appreciate that component of what we do, is that we have it all in-house, or at least a lot of it. And so from that standpoint, that sets us apart as well.
So it's like a one-stop shop.
It is, yes.
Yeah, that's great. So if someone was listening today and they think, man, I'd like to check this out and see if I'd be a good patient here, what should they do next?
Well, there's multiple ways to contact us in this day and age. Obviously, we have email, and we have We have a phone system so they can call our office. Our office phone number is 434-793-0700. And we have another line.
434-797-4455.
So it's easy enough to call and set up an appointment. You can email us. We're available here for folks to get a call in and they can start with us.
And the website has a lot of information too. That website's www.CoreMedX, spelled CoreMedX, CoreMedX.com. And there's the phone number there, email contacts are there, and you can also learn more in depth about the services that are offered. Thanks for joining us today. Thank you guys for being here with us.
Thanks for having us.
Thank you very much.